Yeah, I would.
Okay, cloud it is. All right. So thank you guys all for being here. Not like most of you aren't here every Tuesday, but this was something I caught from the Dallas summit. Obviously, our summit's going to be way more fun. Don't tell them that. But when I saw all the questions come up and with affiliate owners and then the Facebook groups, I was like, okay, what's going on? Jen is obviously one of our affiliate owners in the Midwest region. We've all, know her, talk to her, and what they are doing was amazing. Obviously, CrossFit Medical Society, we know them, they're blowing up, but this new concept of, I don't want to say the word healthcare, I don't want to say the word this or that, just for coaches, just for trainers. I'm going to let them do all the talking. But I think the team, correct me if I'm wrong, but it's Grant, Bridget, and Jen. So if you guys, you can do micro introductions, but I got a feeling that you have a lot to talk about. So feel free to just take the floor real quick
Sure.
and get us going, and I will navigate.
Sure. I'm going to screen share here in a bit and put a little bit of framework and background on the trajectory that the medical society is, and then also obviously try to unpack as much of the community care initiative as possible. I did already put in the chat my email address as well as Grant. Grant, you want to wave real quick? I don't know if you guys can see him or not, but Grant is here from Community Care, and then also Bridget as well. And they are going to be the team and the subject matter experts in terms of supporting our affiliate owners and our coaches through the entire healthcare. It is healthcare. It's not health insurance, and we'll talk about that through their journey. But let me screen share here real quick. No, I want to do. See, is it that one? And I don't know if it wants me to, hold
I
on.
made you a co-host, so you should be able to screen
Okay,
share.
all right. It doesn't want me to screen share anything. Let me see. Universal. I don't know if it wants it. I don't know if it's gonna let me do it. I have to open system settings now. Well, this is silly.
Oh,
That's
don't
okay.
worry about it.
While Jen is doing that, Jen, go ahead. While are you doing that,
I'm
I'll
gonna
just
have to,
do
I have to hop back on here.
okay.
Okay.
Yeah, just real quick. We also have Jason on. Andrew, he leads our education and sales team. And he's got a Calendly link that we could post in the messages as well. He started his conversations this week with owners and coaches. And I think we've had some really good uptake on it, but Jason can kind of lead everyone through the logistics of what this looks like as well. So Jason, I don't know if you want to do a quick intro, but
yeah. Hey everyone. Yeah, I'm here.
Nope. Take the floor. I'm just gonna pull up the screen here and we'll start in a second.
Yeah, I'm the membership advisor, so I speak about community care all day. So yeah, after the little presentation here, basically a Q&A session. I posted my link, as Brandon said, to my calendar. If anybody has questions after this, just throw some time in my calendar and I'm happy to connect. So
Valid, thank you.
All right, so as Andrew kind of alluded to, we were at the Austin Affiliate Summit, what is coming up on a couple weeks ago. Dr. Tom, who is my business partner in the affiliate and McCoy Medical and the CrossFit Medical Society, gave a talk, and that talk was titled and kind of what our 3-word mantra is virtuosity in health. And I think as affiliate owners, we should all be very comfortable with using the term virtuosity. And so just to put a little bit of framework for those of you that might not know a lot about the CrossFit Medical Society, but about a year ago, we started working with HQ on how to put a tangible framework around what CrossFit Health was and what it is right now. And so there was a transition from CrossFit Health, I mean, as much as taking over the Instagram page, to creating a sustainable ecosystem that has tangible, really useful resources for all of our pieces and parts of our community, not only affiliate owners and coaches, but also healthcare providers in the community, to be able to think about what it means to create health homes. And one of the things that we started with is a provider directory. So healthcare providers that currently have a CrossFit coaching credential of any kind can join the CrossFit Medical Society, and they can be put on a directory if they choose to. That's searchable by their specialty, by their country, because it is international, by the specific location that they are in the states that they're licensed in. So this is just a screenshot of what the directory could look like, but you can search for, I think it's 20 different specialties of physicians and then another 26 specialties of healthcare providers in general. And the idea behind that was, as affiliate owners, we wanted to have a resource that you could talk to your members about to help at least give them a pathway to find providers that understand what's most important to them in their life, right? CrossFit methodology, health first, fitness first, kind of all that jazz. Just to share, starting in January, there's going to be another directory that affiliates that are part of the medical society will be able to be searchable as well. So as we push for a universal referral platform, and the medical society being something that we can talk about with healthcare and hospital systems and, a whole bunch of different branches where we can pull them and draw them into the CFMS. These affiliates that have, actively wanted to understand and create ways to support health in their affiliates, we want there to be a searchable platform for them as well. So that's coming in January. You guys will hear more about that. So as I talked about, there are these tangible resources that focus on regaining control of your healthcare journey, understanding what it means to be the driver behind how you want to create health. And one of those resources is direct-to-consumer labs. So if you didn't know that that was an option, you can go onto the Medical Society's website and you can literally purchase labs for what is honestly, comparatively, one of the best and least expensive biomarker panels that exists nowadays, especially in direct-to-consumer. So you don't need to go through a physician in any capacity. But this is what we're here to talk about today, and it's community care. And so what we wanted to do here, right, when we're thinking big kind of 60,000 foot view down, is make sure that the affiliate can establish themselves, if they want to, as a health home within their community, right? Boots on the ground, advocating for health, reaching the people that need CrossFit the most, and then also, valuing and leveling up the way that they can keep and support their current members through a number of these mechanisms. Community care is starting first with affiliate owners and coaches, essentially kind of phase one. One of the numbers that we talked about a couple weeks ago was the average cost of a year of premiums for a family of 4. And Andrew, I tried to put some numbers in because I know that you're a numbers guy, and so I wanted to make sure I
Big
kept
numbers guy.
your attention. So just under $24,000 is what a family of 4 can potentially expect to pay for access to pay for more health insurance, right?
Yeah.
And that's mind-boggling to me. Like, I'm a family of 4 and I'm a small business owner, and the fact that that's what I would have to put out for premiums is just, it's crazy. This is just kind of a visual that depicts like an individual comparatively to a family, so single versus family health insurance coverage, kind of across all different plan types. And we can see just what the expectation for paying for access to healthcare could and should be. So kind of planting the seeds as to why we are an advocate of community care. Obviously, these are a number of health insurance companies that I'm sure we've all heard of or worked with before or familiar with. One thing that I just kind of want to say, and it's my own philosophical approach, and it's come with a lot of research that I've done, but when we're looking at industrialized wealthy nations, the United States is one of the only ones that doesn't automatically offer healthcare for its citizens. And you can almost look at that as kind of like a moral approach. That's not something that's built into the way that our government kind of takes care of its citizens, but just wanted to also bring that up. Other numbers, Andrew, 50% of folks in the US potentially fear bankruptcy due to a major health event, right? And we've talked about this in a number of different approaches that the CrossFit affiliate owner is potentially one financial crisis away from shutting down, whether it be healthcare, whether it be a hurricane, whether it be a fire, whether it be something, a car accident. Like, we kind of run that line on a fairly regular, for what it's worth, basis. And healthcare and major health events being one of those concerns. Just generally speaking, right? We see that a lot of the bankruptcies that are happening in the US are tied to medical debt, right? So we are fighting against a system that is just costing us a lot of money. Some more information. You have your health insurance, but then I'm sure you've seen in a number of different avenues the fact that you need to have additional insurance with your insurance for other things that your insurance isn't actually going to cover, right? And so this is to get you thinking about, you know, how we can better take care of ourselves and our families. Andrew, more numbers, right? If we look at what the per capita expenditure in the US, right, we're at the top, but we have terrible health outcomes, right? So we're spending a lot of money, and we're not the healthiest or the folks that have the longest lifespan by any means. And then this is a pic from actually Dr. Tom's office during COVID, I think. Okay, so the point being, so then what do we do? We're CrossFit affiliate owners. How are we going to understand and address the problems that we've identified? And the answer in conjunction with our partners at Community Care is this, right? It's the solution. Taking back our control, right, in our healthcare journey without having to pay for traditional health insurance. And importantly, right, it's built on prioritizing health, understanding that that's a pillar of who we are as humans and as business owners, and using our community to support those health objectives. I'm going to just talk a little bit about some of the pricing structure, because I think that this is where a lot of
can
the—
you go back? Can you go
Yeah.
back? Okay, hold on.
Sorry, numbers, I went too fast.
Yeah. You can't run numbers past this guy. Okay, cool.
Yeah, right. So kind of like the individual. So there's two numbers that go into what you're going to pay on a monthly basis. And we're going to talk about both of them. And so this is based on the individual, but there is obviously the family expansion of this, right? So affiliate owners and coaches have access to this as well as their families in phase one. So if you have your monthly price, right, there's going to be one monthly advocacy fee that is part of what you're paying each month, and that's $55 an individual. But I think that this is really important because it's not just a fee that you're paying, you're actually getting a lot in exchange for that fee, right? Community Care is an app-based platform where the entire system is going to live and operate to make it really easy and accessible for you to take care of your healthcare needs as they come up. Okay, so that in and of itself, I think, has insane value.
Can I have a quick pause, Jen? Sorry, I know I'm just in the deep here. So I'm summing this up as a person who used, it wasn't Christian healthcare ministries, but I think I used the other one for like 3-4 years and had children based on this thing. So like I've been in this. So right now, what you're saying so far, for $55 a month, that's going to be the fee that goes towards, like, that's just the base. Hey, to become a member, that's just the base, and you're going to get all of these things just for $55 a month.
That's correct.
Okay, cool.
Yep. That's correct. And so, yeah, right, similar to probably your experience in that health sharing platform, right? This is a crowd-funded healthcare platform. So app-based, right? With that, you do have access to virtual talk therapy, virtual primary care. As you've met a few folks in the community care team, right? You're also going to have a dedicated care advocate. Her name is Lizzie. She is amazing, right? So she will help navigate and negotiate your bills for you. You will also get, right, and you can submit this for reimbursement, but that biomarker panel that I alluded to, you get that once a year, and then a yearly wellness visit as well, right? And so that's just for being a part of community care. So that's
quick question. Sorry, we had a question in the thing. I believe you said this, but I just want to clarify. That's per person, not per group. Okay.
Per person. Yep. And so that's like understanding part one of what you're paying per month, right? part two of what you pay per month then is the crowdfunding contribution, right? So the part that take care of the health needs of the community. And so these are maximums that are set and established by community care. They will not go above that. And most of the time they will actually come in below that, right? And I'll let Grant maybe fill in some holes with some specific statistics after this. But an individual, so from age 0 to up to 54, your maximum crowdfunding contribution every month is $140. So at most it's $140 plus the 55 brings your monthly maximum to $195. Okay. And then the other numbers are tiered for different age groups and then families of 4 and plus. Okay. I do want to make sure that everybody kind of understands that last bullet point when we're talking about health events, right? And so I think that the best way to conceptualize what a health event expectation would be is that no matter how much the bill is, $500 or more, you are agreeing to and understanding that the first 500 of that health event you're responsible for, and then you would submit the rest to be crowdfunded. Okay.
That is the lowest. That is insane. First of all, because I'm sorry, I got to choose how deep I wanted to go to lower my monthly, call it a premium, and I was responsible for up to $5,000 or $4,000 or $5,000 in the very beginning. I see Jason nodding his head because that's absolutely nuts, guys. $500 is nothing. Okay.
And like, keep in mind, right? We're a fairly healthy cohort.
That's per event. So if you have 7 events in a year, it's 3,500.
That would be correct.
Oh yeah, but dude, I had to go to the hospital because I'm allergic to a leave, and it was 12 grand apparently. You know.
So those are the two buckets, or how your monthly total comes into play. So some points about enrollment, if you will. You would go to the CrossFit Medical Society's website. There's a tab for community care. There's a ton of information on there. An article about why this isn't health insurance and why we don't want it to be health insurance, and kind of some additional information pulling out how we want to focus on advocating for health versus maintaining the high cost of a sick care system, in addition to how you will enroll. And so I just want to be clear that it's not an open enrollment period, right? Like traditional health insurance has open enrollment. You can sign up for this whenever you want to. So in 6 months from now, if you're like, you know what, this is really a good idea for me, like, amazing, do it, right? I will say that for our community, right, eligibility for funding, right, and when you would be responsible to start paying is going to be as of January 1, right? So you can definitely sign yourself up, go through the whole process, spend time understanding kind of how the process works between now and January 1, but that's when we're essentially open for business, for what it's worth. And then, I think the really cool thing is that we, by nature, have this unique built-in component of community, and it just feels really good to know that we're able to create and embrace a structure that aligns with the things that we have most important in our everyday kind of like self experience, but then also in our business as well. So just a couple pictures there. There's a QR code if you guys wanted to quickly like pop it up. But again, I'll make sure Andrew has all the links to follow up with. Before I stop the screen share, just a couple other things that I wanted to point out. We are doing like a bigger ED webinar on Thursday that will go into a little bit more granular detail about the CrossFit Medical Society in general. But what I will say is if you are an affiliate owner, for me personally, because I've done this with my coaches, I would have never been in a position to be able to offer them healthcare in any capacity, health insurance, I should say, in any capacity, right? Doesn't matter what I was capable of. What I can do is I can pay $55 a month for 5 of my coaches to be able to have access to this platform. And then they only have to worry about the crowdfunding part of it, right? Because I buy them that and coffee and like freaking protein shakes.
Right. So they're only responsible for $140.
Responsible for the 140 part. And then that for me was a huge value add as an affiliate owner to say, like, especially for the few of them that are like, all they're trying to do is make their career out of fitness, right? So they're 32 years old, she doesn't have health insurance, like all this stuff is like well, this is really cool for her, right? And it felt really good for me as an affiliate owner to be like, here's a value add that like I want to extend to you because I believe in this and I think that it's super helpful. Okay.
Wow. Wow.
All right.
I have so many good questions that I will keep as short-winded as possible. And I'm sure Grant, Bridget, Jason, there is.
Just
So to be clear, that was very clear. Thank you, Jen, about how it operates payment-wise. I think a lot of people, what throws them away from health share plans, et cetera, it's so weird. It's such a weird concept to people not to have quote unquote health insurance. And the way to look at it is that what happens? I go to the hospital. Let's use I'm allergic to a leaf. Apparently, I'm allergic to a leaf. Didn't know that. 36 years. And I woke up, passed out. Ambulance comes. First of all, I'm thinking I'm covered because I have health insurance. It's one of the things that goes through my head. If I was using your plan, here's how it operates. I go to the hospital. They do all the same tests. They find nothing. Keep me in there for 12 hours. They run up the bill like crazy. I'm in so much pain, I can't deny a test. They give me a $12,000 bill. At that point, I'm paying $500. Your team is going to go negotiate the bill, more than likely, with them. But I'm only out $500. Yes or no?
Yeah, that's correct, Andrew. So yeah, you would just wait to receive those bills, submit them. We would do post negotiation. But yeah, ultimately $500, even if you had a follow-up visit with that, right? You've already met your 500 for that specific health event. So even if there's multiple follow-up visits or medication, you're still 500 for that specific event. Yeah.
Wow. I don't know. I never made it when I was on the health share plan for 3 years. I never used anything, even had kids on it. But now apparently once I have health insurance, that's when everyone gets sick. But anyway, so the same event, I assume that's going to be logged in some sort of app or something, right? Like I go for an event and then it's a follow-up so I don't keep getting charged 500.
Yeah, it's all app driven. So you would create a health event within the app, and then any bills, receipts that you receive, you just attach to that. And then your care advocate has visibility to that as well. So yeah, super, super simple.
Okay, now is there ways? A lot of people are into preventative health as well. I know there's, vision, all this sort of stuff. Vision and dental, we're kind of on our own, right? From what I would assume.
In some capacity, yeah. The $300, I'll call it a stipend, but basically what you can submit for a preventative care visit yearly. So it's just a perk of the program. If you want to use that for a dental cleaning, x-ray, vision exam, you definitely can do so. So a lot of flexibility there. Most people use it for like a physical blood work. But outside of that, for dental vision, yeah, there's no funding for any expenses related to dental vision.
So how I understood it is you're pooling your money to this. Correct me if I'm wrong, but this started with Christian healthcare ministries. This whole concept, because a group said, "Hey, we're Christians. We want to do this together. We want to share suffering." And I feel like it like moved on to now you don't have to be Christian, yada yada. But so where does the money get pooled and hang out? That's like the one question. Are you investing it? Are you throwing it into Dogecoin? Like what, and flipping it? Like what's going on? Because that was always confusing because when I do pay someone, I like to know, I don't care where it goes. You can do the most investment money. You're the running the business. It's your risk. But that's always a confusing part. You just keep it in treasuries. Like, do we just trust that we're going to have more people? Because what if it turns out I have this crazy rare blood disease that I didn't know about right when I started, and now I'm millions of dollars in healthcare in my later 20 years.
Yeah, so that's a unique thing with us versus health shares. We're not a health share. People compare us to health shares. We're a crowdfunding community, kind of like a high level GoFundMe, but we facilitate it. So traditional health shares, yeah, they hold reserves, right? They charge the same amount every single month. Those are held in reserves. The crowdfunding component of pricing, that up to 140 for an individual, that does vary based on the needs of the community. So when there is a month where there's a lower number of bills submitted, everyone benefits in the community. We're only going to ask what's needed. So there are no leftover funds. It's just more transparency. So you know exactly where your money's going. We'll actually send you a crowdfunding request one per month. So it's nothing overkill. It'll come via email as of now, via app here shortly. But that'll come through and it'll say something like, hey, there's a member in Texas having knee surgery. Will you fund X amount of dollars up to that 140? And there's nothing you need to do to the email. By default, it goes through as a yes. So our members like that you don't have to scour your inbox. And so, yeah, we just gather those funds, not to get in the weeds with this, but we have like an internal bank account for each member, where we hold those funds until we have the amount of funds to suffice the bill. And then we release those funds directly to the member in their personal bank account. So yeah, it's a completely different
that is
setup.
so cool. That is so freaking cool and very noble.
I got a question. Is this group starting from scratch with us, or are we being led into an existing group of a whole bunch of people that already have
So
track record? Because
Yeah.
if 25 people do this, there's not enough money for even one
yeah,
catastrophic. That's
good.
I don't.
Yeah, it's a good question, Bill. So the partnership between Community Care is with a company called Crowd Health. So you can look up Crowd Health. Crowd Health was funded in 2021. It's based out of Austin, Texas. We have a little more than 7,000 members of Crowd Health, and that's what you could liken to like a Sedera or one of these other crowdfunding ministries. We grow about somewhere between 3.5% and 5% a month, and have since its inception. We funded almost $10 million in medical bills over that time period, and so that's kind of the foundation from which we'll grow Community Care. So initially, everyone will be part of the crowd, the broader crowd, as part of Community Care. And as the CrossFit crowd, as the community grows, it will be its own kind of self-sustaining crowd. Usually, let's say somewhere between like 1,500 and 2,000 members. But that
Okay, so we
crowd
can have
has
our
a
own.
significant history.
So
Oh
we
yeah,
will
that's
have
the
our own.
intent.
Okay.
That is the intent long term, right?
Yeah, we don't like to share well with
to
others.
Bill's, well, and to Bill's point, right? Like, you know, we're growing this from a place of stability where, you know, Jen said we throw out some numbers. We've only asked for the crowdfunding maximum 2 times in 3 years of our members. We've only
Incredible.
ever asked for it 2 times, and our lowest month, if I have to do like the range here, right, was July of this year, where I think we were a little over $60 was our ask. And these aren't anomalies, right? Like we're attracting healthy people who are tired of being taken advantage of by a for-profit publicly traded health insurance company. And their incentives are aligned. Their incentives are to stay healthy. So they do the work to stay healthy, and we provide them with all the resources we can to keep them healthy. And so we have an insanely healthy network of members, and we're hoping to add a heck of a lot more accountable, healthy members as well. So,
Yeah,
Bill, I hope
great.
that answers your question.
Thank you. So the initial thought would be from a lot of people, I would think, is, well, let's just watch and see how it goes for the first 3 or 6 months.
Sure.
But I'm at a point now where I'm in a renewal for my medical insurance. So go with me here. You just found out I'm your long lost uncle. Would you, in good faith, suggest to me switch from my existing health insurance, which is costing me a fortune? It fits right in line with the numbers that she put up, and go with this. I'm basically healthy, but who knows what's going to happen? Is it safe to cancel and switch onto this?
Yeah, you know, I
That's a
tell
loaded
people,
question, but
yeah, well, we're not a good fit for everyone. We don't want to be a good fit for everyone, right? And
might
that's
be a
what
good
makes it
fit
super
for a
sustainable,
healthy
right?
30-year-old. I'm a 60.
But no, yeah, and we have a large number of members in that 60 to 65 range that, whether they've retired early, you know, waiting to go in Medicare, whatever the case may be, right? And then to save costs, we have a lot of self-employed business owners in the community. But one thing we don't do and fund would be pre-existing conditions. So you can definitely join. There's just no funding for pre-existing conditions in those first 2 years of membership. So when I talk to people that have those major pre-existing conditions, we're generally not a good fit. But if you're healthy, you know, most people go once a year for the preventative care, colonoscopy here and there. You know, you have the telehealth for the small things, anything of substance, you know, the most you're out is 500. So yeah, if that fits you and your kind of health journey throughout the year, then yeah, absolutely be a good fit, especially if you're saving that much money.
Mhm.
Yeah, I felt the same way, Bill. I felt the same way when I was having kids. Had no idea. CrossFit had just ripped our insurance. That was a long time ago. I didn't know what to do. And me and Joe DeGain talked about going on this health share plan. And his son had to have some crazy knee surgery, weird thing. Like it got really, he had like a rare disease where it's like, I don't know, something happened and they had to do a ton of stuff. And he racked up like $30,000 or something on a credit card. I remember him telling me that's not exact number. It was a lot. And we were nervous. Like, man, I don't know what's going to happen. Sure as shit, they paid back. They paid the bill. They negotiated the bills and then paid it. But it is right. Like you're like, man, would you tell your mother, your father? Like, I don't know. I think with healthy people, it's different. And I do trust the medical society. And Grant just had some amazing clickbait, kind of fighting the powers that be. I mean, all right. So I saw the HSA comment.
Mm-hmm.
Can anyone talk on that?
I haven't even looked at the.
Yeah, so
Sorry.
Yeah.
can you contribute to an HSA with this type of plan? So my understanding, and the team can correct me if I'm wrong, but your HSA cannot be used to pay for your like monthly contributions or your subscription. However, if you do have HSA and you are responsible for the $500 kind of cash pay portion of your event, my understanding is that your HSA could be used for that.
More
Yes,
to
and
the
understand. Go
yeah,
ahead,
more
Dan.
to the effect of, can you contribute to an HSA if you're on this plan? Because
Yes,
traditionally
Dan.
you need a high
You can
deductible.
open up an HSA with most banks that are in your city. You do not have to have health insurance.
Oh.
You can. I know. I have done it. There's one right in town, so I would go look around on that.
I mean, I have
Derek
one.
gives me Derek gives me a thumbs up. One of the best investing tools humanly possible. Put $500 in, and then click the button to invest the rest in their index funds. Obviously, TrueMed loves HSAs. Learn more on there, but what this just
Jason,
seems, it's not.
Oh,
Go ahead.
sorry. Go ahead, Andrew.
No, I have nothing. This is just my call, and I talk sometimes like crazy. So just take it away.
Jason, let's touch on prescriptions, because I think it's a good one for us to have folks wrap their heads around, if you don't mind.
Yeah. So if prescriptions are tied to a health event and you've met your $500 commitment, then those are fully eligible for funding, up to 120 days supply. After 120 days, then it would be the member's responsibility. You will be, it's a benefit prescription provider that you have access to. So somewhat like GoodRx, but better. So you can purchase prescriptions for that at discounted rates. And Bridget, maybe you can expand on that a little bit, because, let's think worst case scenario here, like cancer, right? Chemo could be considered prescription, but that's going to be different as far as the 120-day supply. So Bridget, you want to expand on that, because that would be fully eligible through the journey of cancer. Is that correct?
Yeah, so you can think about your prescriptions in terms of prescriptions that are going to cure the root cause issue, so curative medications, versus medications that are only treating the symptoms and won't lead to a cure, is typically how we differentiate between those two. So most people, for most illnesses, curative medications are not needed for longer than 120 days. And so that is more than enough medication help for them on a health event. However, if you do have a very serious issue that has a curative medication along with it that requires taking it for longer than 120 days, that can be eligible for crowdfunding. Cancer is a perfect example of this. It's the maintenance medications that this part of the member guide typically hits, right? So if you have a medication that you are taking simply to help control symptoms, and so you're on it long-term, maybe years at a time, that is going to be something that the crowd will only help you with 120 days worth of that prescription every year, new health event every year, once your $500 member commitment has been met.
All right, real quick, completely switched, because we could do these individual type person questions all day. Grant, Bridget, Jason, why are you doing this? Why are you caring so much about keeping healthy people, not allowing the corporate, giants to take away money and, just all the bad stuff? You guys seem like you're actually fighting, and this is the community of fighters. We're all affiliate owners, and we came from an element of like, yeah, we're changing the world, and we did. We changed the world with CrossFit's methodology. It's the best fitness methodology. Even if out of nowhere tomorrow every affiliate closed, we would have changed the fitness world over the next 200 years. Why are you guys doing
I-
this? Go ahead.
I don't know, maybe people might like this response or they might think I'm an asshole for saying it.
No.
But
I like it. I already like it.
I've 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 been in healthcare for 20 years. And I've done everything under the sun. I've opened clinics, I've ran ambulatory systems as part of hospitals or health systems. You can go look at my LinkedIn if you want to look at my sordid employment history. I sold my telehealth company to an EHR company in 2019, the year before the pandemic. So let's just say we hit our deal model numbers that next year. At that point, I architected the sale of that EHR company to a PE company last year. For the first time in my career, I had an opportunity to actually like pick the next thing that I wanted to do. And kind of nudging the current health insurance system off course has always been something that I've wanted to do. And I met Andy Schoonover, who's the CEO and founder of Crowd Health. And in one conversation, I knew that what we were doing here was different than what I've seen in this space. It's different than healthcare sharing ministries. It's different than the other health shares. The model's sustainable. The approach is really solid, and the management and the partnership and the support that we give members from the moment they arrive in the community throughout their time in it, and every event, everything that they need. It's a model that I think has the ability to kind of disconnect people from the current system, and it's just unsustainable. Healthcare costs have been rising the same for 20 years since I've been doing that. It just there's at some point there's a breaking point, and at this point we're bleeding this country dry in health insurance premiums, and we're not getting anything for our money. It's not making people more accountable. It's not making them more healthy. It's not doing anything for longevity. And at some point we have to align incentives. And I truly believe that, and that's why I put all of my time and effort and energy into this company over the last 6 months, as the head of product for Crowd Health. It's the way that we're going to make a meaningful impact on the healthcare system. I truly believe that.
Wow, Grant, well said. Well, Grant, I will tell you one thing. The last person who was on this call who leaked early ended up going on Joe Rogan and ended up being with RFK. And at this point, they're so cool that they don't remember that I'm the one that leaked it early that got in trouble and got all these people on. So I do want to say something. Please don't forget us. Please don't forget CrossFit.
Yeah.
Please don't forget if this takes, no, I'm dead ass serious. Like we are such a community that wants our people who do Fran, who squat below parallel, who give a shit about what they're eating and avoid processed foods. We want to be in a room with them with our own dollars, supporting them. So like, I love it. This is really cool.
Well, yeah.
Guys, if you have any questions, they're here till 2. So I think to respect the shouting game, maybe, I don't fucking know. What's the easiest way to do this?
Can we raise hands? Can you raise hands?
Yeah, do a little raise hand thing. Try, Dan. I know you're literally raising your hand. Let's let Mitch go real quick because I personally, guys, I just really want him to go. He's been struggling with something like this, and if this could offer him any help, I would love. Mitch, go ahead, buddy.
How does it? So my wife's a teacher, so we have pretty good health care, albeit it's ridiculously expensive for nothing I use. So she's probably not going to let that go. Like, so we have adult children. We have a 21-year-old we're trying to keep on healthcare so she can save as much money as she can. And we have a 24-year-old that's finishing up college, and he's actually a CrossFit coach. So I could probably cover him with this. But how does this work? The way I kind of explain our insurance to my wife when she gets mad that I go to a different doctor that isn't 400 pounds and covered by insurance, is that her insurance is in case I get cancer. It's in case I get some horribly expensive physical. It's like my life insurance. It's worst case scenario. But to keep me healthy and doing the things I do, that's me hanging out with people like you guys and working out and doing jujitsu and not eating shit. Like it's not that complicated. You know what I mean? For me, I'm sure I'm 51. It'll get more complicated, but I can barely read a screen anymore. But for the most part, I don't have many healthcare needs. If I did, I probably didn't go to the doctor anyway because I don't trust most of them. But how does this interplay with some of those things? She is not gonna let it is likely because of our school district, I may potentially lose my healthcare as my kids might. I mean, dependents are going to have to prove they can't get it. My daughter has a job, she can get it. My son will have one by the time that goes into effect. I don't know that this is health insurance, but I don't know that I don't know how that plays in. I mean, I'm not going to buy health insurance, or at least I don't want to. How does all this play with that? Is that like, hey man, if you can get traditional insurance, it's probably going to save you a lot of money? Or is there kind of like, hey man, this kind of, there's this mechanism for all those things here?
Yeah, I think I had a fairly brief conversation with someone in Austin that asked a very similar question. And my first question back to him, like a discovery and like orientation kind of thinking, was like, okay, like so what it sounds like is you have health insurance because you need a safety net.
Yeah, basically.
Like, let us be your safety net.
Okay, so I mean, it's not health insurance because that's just legally not accurate to call, but
correct. Yeah.
I mean, I hate all forms of insurance. I feel like I'm paying the mob to not kill me. Right? That's what it feels like. That's all it is. I think it's like, oh, pay you in case I get sick. Oh, that sounds like a good deal. Like,
yeah. I mean, I think. Oh yeah, go ahead, Jason.
Well, no, I was going to say, like, I hope this is answering your question. Like, people leave their traditional model and join us and use us as a standalone. Very seldom do they combine it with traditional insurance, just because economically it doesn't make sense. And even if something catastrophic happens, there's no limits on the amount that can be funded. So, and we also have a lot of people where the spouse will, they'll split up as far as the health insurance options, where, one spouse stays with their employer and then the other spouse and children join us. And it's just a numbers game. They save a lot of money that way as well.
Okay. It makes sense.
Cool. I got hands now. Sorry, Mitch, I didn't mean to cut you. We'll go Dan and then Jeremiah. Dan.
Yeah, not to be the pessimistic one, but if I'm looking at this is a good 50% cheaper than a high deductible health plan that I'm on. How is that possible? Like, what's the catch, in other words, to be the kind of pessimistic person here?
I mean,
Dan was a banker. Dan was a banker.
Our CEO doesn't make $25 million a year, which is a really good start. Like all of the structures that have been put in place and on the commercial health insurance front are, I mean, you should look at like the org chart at Optum or UHC or Anthem or any of these publicly traded health insurance companies. They pay for a network. They're paying for care coordination. They're paying for care management. They're paying a lot of money to not pay bills, is the gist. It's like an oversimplification of it, but we are administratively focused. We're lean. We're not health insurance, so we don't fall into all of these regulatory quagmires that you see in the insurance space. We're not in that. We're not a healthcare company, so we're not doing that. We're a fintech company. It's essentially crowdfunding of healthcare bills, and we have an enormously valuable care advocacy staff that helps people navigate this system and their detachment from this broken healthcare system, or at least the healthcare payment system. So we just don't spend money on things that aren't necessary for the crowd. We only fund what's needed, right? So like when you go back to that like breakdown of the cost, the $55 fee goes to pay for employees. It goes to pay for our care advocacy, telehealth, the people that build our app, my team, right? So that's one piece. And then the crowdfunding piece is only what the crowd needs every month to pay bills. That's it. And so it's not like, oh, well, we'll take a 10% cut on the top. No, like we don't take any of that money. Like our incentives are aligned as yours are, right? We want to control and maintain and contain costs for the community, but we're not denying people's bills because we don't have, we didn't save enough money, right? I'll shut up, right? But there is a percentage, right, that was set that health insurance companies can only make a certain percentage off of your premiums, right? So if I'm a publicly traded health insurance company and I need to grow 3 to 5% a year, what do I have to do, right? I have to increase your premiums every single year to make money. How fucked up? I'm sorry. How fucked up is that? Like that just doesn't, and we're not in the same, we're not in the same boat, right? So anyway.
No, I appreciate that.
I was gonna add the 15% number that Grant just shot out there. That is just kind of what happens and why we're seeing the uptick in premiums. And then I think too, like if you guys do end up going and doing some due diligence on the website and the blog that kind of explains why this isn't health insurance, like I think it's 17% of health insurance claims don't actually get paid for. They get denied, right, by the health insurance companies that you're paying for premiums. So that's almost 1 in 5, right, that have insurance that are paying premiums and they don't have a team that cares about them fighting for a better negotiated price, and like they're just denied. Like it's ridiculous. Like it's just it's who was I talking to yesterday? Like we say that it's a dysfunctional system, but like it actually works really well for the people that are incentivized to make money off of us, right? So it's not where we align ourselves, right? It's not that it is, fucked up, but it's working exactly how it's supposed to, right? And it's to make sure that we can have to pay high dollar amounts and not get the reimbursement or the care or the funding that we need to take care of the things that are most important that keep us healthy, right? And we're a comparatively healthy group of people, right? Compared to the population, that deserve the opportunity to invest those funds in our community and in our businesses and in our families, and really truly continue to make a difference to how we are going to advocate for the improvement of health on a larger scale. And paying for sick care is not appropriate, in my opinion.
Woo, this is fire. Hey, Grant, I want you to invest my money.
Can I jump in really quick? Because I want to say something along this lines. Dan, how is this so much less expensive than insurance? And yes to everything Grant and Jennifer have said, but also it's because the members care about the cost of their medical care. When you have an insurance company as this middleman, you go, you receive care, you throw down your card, and you have absolutely no idea what in the world the provider is going to charge you before you get any of that care. The insurance company handles it, and then you possibly get a bill for thousands of dollars, completely unexpected, on the back end for medical care that you thought your insurance company was going to help you with. And our members are proactive medical care consumers. They pay attention to the cost of their medical care outside of emergency situations before they receive that care, just like we do with everything else in our life. Like I have my insurance adjuster coming out, check my roof tomorrow because we had some damage recently. And I'm not going to have someone come and fix my roof and then just bill me whatever they want to on the back end. Like I'm going to make sure I know going in to that repair what it's going to cost me. And we do the exact same thing with our healthcare expenses, and it makes a huge difference. One of the great things about America is we are a free market society. I think it's one of the things that makes us so strong. It's one of the reasons so many of you guys can open your own CrossFit gym, right? And we take these things seriously and pay attention to these type of things. So it helps keep our costs low as well.
Well,
Wow.
thanks for this. Has been really good info. I'm going to think about you're disrupting the health insurance industry, which is long overdue.
For sure.
Think about Greg Glassman. He disrupted the hell out of the health and fitness. I thought it was odd 15 years ago when he came up with the idea of having our own insurance company. If you guys know the RRG, the Risk and Retention Group, Glassman had that idea and floated it out in 2009. Had us all sit through presentations in 2010 in Miami, listen to this insurance crap. It's like, what are you talking about? It seems like it turns out to be one of the best things for our gyms. So I'm hoping that this is the same. Thank you.
Thanks.
Jeremiah and Mary Day, I think we'll squeeze you guys in. Jeremiah, go ahead.
Yeah, I just got like 3, should be quick, like nuts and bolts type questions. The first one was, is there like a contract time, or is this like a monthly thing? So if I decide 3 months down the road, this isn't something that works for me, can I switch out of it?
Yeah, super
Yep.
flexible. It's truly month to month. So yeah, you can leave at any point in time. The only if you want to rejoin, you'd have to wait 6 months. There's a 6 month waiting period if you wanted to rejoin. So it's actually harder to re-enter than to leave.
Okay.
Ooh, I like that.
All right. And then this is you guys mentioned that you like, if it's an over $500 event, the bills get sent and basically you have someone that helps negotiate that pricing. What if it's an under $500 event, right? I know you guys aren't going to cover it, but can you still, someone's going to listen to your ability to, negotiate price over someone like me. Is that something we can still use you guys for?
Yeah, and Bridget, maybe you can expand on this, but we still can help navigate the event, but most importantly, tell you if that's a fair market price. So you're not getting gouged even on the smaller events. We also have vouchers for blood work, and so we can intervene with that as well.
Yeah, we have some really amazing partners that are working with providers in the uninsured self-pay space and have great resources to help our members shop and find fair market price care.
Okay, perfect. And then the last one for me is, as far as date of billing, I know there's the $55 and then whatever the crowdfunding part is that billed at the same time, or is that separate times throughout the month?
It is 2 separate times. So the $55 advocacy fee, that'll be billed on the day you actually choose to be a member. So if you choose January 1st, every first of the month will be that charge. And then the crowdfunding component, we try to keep that at the same part of the month, but there's no guarantee. It'll just be the latter part of the month is when that goes out. But once you receive that request, 2 days later will be the actual transaction. So yeah, 2 transactions.
Yeah. And Jeremiah, guess what? I'm just on the business side. If I were to roll this out to my coaches, I would say, like Jen said, I'm paying your $55 and I'm paying an additional $30 for 6 coaches. So I'm doing this so low key, if like Grant said the one time they only charge 60, that coach might only be responsible for 30 freaking dollars to be covered for any event known to man. If they want to add their family. If you guys start to frame your vernacular that way when you're introducing this, and it's scary because you're like tiptoeing around, like, should I say insurance? Just say I got you covered. I don't know. Maybe that's not the way you talk, but that's the way it feels. How I would roll it out to my coaches, the ones who don't have health insurance. I got you covered. Don't worry about anything.
Jeremiah, the reason for that variable crowdfunding date is just, we stack bills up throughout the month, right? And then we're crowdfunding them as we go. And, generally we start to see that volume like ramp up into the end of the month. And so we have a lot of, we're just handling as it comes in. So we're not collecting anything up front and then trying to pay it out off of that. We do it as they come in. So.
Okay. That's all I had. Thank you guys.
I do want to comment real quick on the question about rolling it out to our community members. And I want to say that that's an important focal point for us in terms of rolling through the next, hopefully 30 to 60 days. Andrew, I'm going to send you a follow-up email that has some direct links that if you want to push this out, and on there is going to be a waitlist link that, like, if any of you are talking to your community members about this and they're like, dude, that's awesome, I want to get on this waitlist, like, I have a link that is collecting people that are in your community that want to know more about this, that want to know when it would be opened. There will be some additional kind of criteria that goes around how a community member joins, right? Because we are health incentivized, right? And so also being a member of an affiliate needs to be part of that, right? So like being your members is an incentive for them to have access to this program. And so that's another way to kind of pillow yourself as a leader in your community, because Joe Schmo Jim down the street is not going to be able to do this for them, right? But like you can. So.
Oh yeah. Merry day.
I guess as far as the members go, will there be any surveillance of attendance to the gym? Like they'll have to come X amount of times, I'm assuming.
Theoretically, that's the initial framework, right? And so is it 3 times a week or 12 times a month, or what are some of those nuanced details? Like we'll present that to everybody once it's ready to go, but yeah, and potentially appropriate glucose level.
Yeah. And then I would just add that the unlimited virtual talk therapy is a pretty impressive component because if you're paying for monthly mental health care, that is a very economical way to get needed mental health care. It's impressive.
Wow, this feels like
Wow.
old school days.
Owners and coaches can join today if they want to. Eligibility for their crowdfunding will start on January 1st. So if you want to go ahead and get through the process and get in the funnel and get familiar with the platform and all of that stuff, as we're rolling this out, you can definitely get on there and get it going and know that, you know, January 1st would be your start date.
Well, I want to respect your guys' time. This was probably a small version of what you will get on the bigger call. I'll be honest with you though, Midwest participates. You might only get about this amount of people anyway. Jen knows. We appreciate what you're doing. Grant, Bridget, where did I lose him? Did he drop? No, Jason, he's there. Don't let the passion let's go. You know what I mean? We're a community that thrives off of that. And the more confident you are, the more confident they are. So don't be afraid. Like, I loved your sign. I think the sign at the summit said, like, are you sick of paying too much for unhealthy people or something like that? That's that shit. Like, keep that going. We want to support you.
Sorry, I want to say one more thing.
Yeah.
We did not get around to, and I hope it's okay to say this. We do have a referral fee program. So for any of the, when you sign up, you'll get a welcome email that includes your specific referral fee. And if anyone after you signs up using your referral code, and then once they're members for 3 months, you will get $250 per primary member. So let's say that a family of 3 joins, that's just going to be $250, but for every individual that joins with their own account, that's $250 for them. And we are running a special right now for any of the very, very first community care members between now and November 15th. If you sign up between now and November 15th, which we're 3 days from, then your referral code will actually be worth $500 for any members that sign up using it by 12/31. So I just want to tell you, there's a little umph in signing up quickly, but also you have the opportunity to tell people about it and make a little money off of it.
Now you can make your affiliate fee right there. That's another story. We don't even go into that, but we appreciate it. If I don't want to flood. I feel like people probably, are going to have more questions and comments. I'll answer as much as I can. You guys have access to Jen. I think, Jen, you're in our Facebook group too, right?
Yeah, I
Gotta
think
be.
so.
I spam. That's the only thing I spam to the affiliate owners. Get on the call, join the Facebook group. What else? I don't want to send you any other little emails about stuff.
No.
Bridget, could you repeat that again real quick? If we sign up in a couple of days, you get $500 to give to somebody else to sign up. Like if my wife would sign up after me.
Not quite. So Bill, let's say you signed up by 11/15 and you and your wife are going to have separate accounts. Okay. When she signed up, she would use your referral code. You're going to get that referral code given to you in your welcome email, and it's specific to you. Our system knows that this is Bill Russell's code. And so anyone else that comes and signs up and says, hey, Bill told me about this, by putting your code in there, they're going to be tagged with you. And then once they have been members for 3 months, so since membership doesn't start until 1/1/25, so we're talking April next year, anyone that has signed up using your code and stayed a member for 3 months, you'll get a referral fee. Now, if they sign up before December 31st, wow, a lot of numbers, this is really confusing. If they sign up before December 31st, the referral fee is going to be $500 for you, so long as you signed up before 11/15. But if they sign up after December 31st, the referral fee is just the normal $250. $250 is the normal, so that's probably the easiest number to remember. But if you sign up fast, you get a special ump for being some of the very first in the community care.
Bridget, that's so cool. What about the people now listening who have FOMO, who already have health insurance, but want to roll this out to their gym?
I think Jennifer and Grant and I will talk about it, but let us know if you have anybody come to you and say that.
Yeah,
when are you going to pimp this out?
I mean, I can pimp this out whenever. you know me, I'm not going to wait to be told if it's okay to do so. So, I mean, but also I don't like to write long emails. I mean, I can sum this up very, very shortly. Like, we did it, guys. We did it. I am so happy. I can just see it one day, like, hey, can you deadlift your body weight? Okay, boom, premium. Here you go. You're in. You know, can you run a mile in sub 10 minutes? I know some of you are like, fuck you, don't put that shit in there. I don't want to do the mile, but you know what I mean? Like, that's what we're after. Yeah, Jen, we can work together. I don't know. We'll do something.
Yeah, we'll
But
the enrollment link is on the CrossFitMedicalSociety.com. So www.CrossFitMedicalSociety.com. Community care is on the top of the navigation. Log it down, it'll say sign up. That's pretty cool.
Yeah, and
Cool.
if anyone has any questions, I put my Calendly link in the chat there. But also, if you go to community care and it says talk to an expert, that comes directly to me. So feel free to
You're the
schedule
expert.
a 15-minute call. I'm an expert, so happy to connect and answer any additional questions.
Sweet. All
Thank
right. Well.
you so much for your time. I appreciate it.